This morning, we're delighted to have Dr. D.K Asante, who will be talking about flu and also taking all questions about general health. So Diana, we're ready for you.
Right. Good morning. Good morning, everyone.
I think your camera is off.
All right.
I can see you now. Yeah, great.
Okay. Right. Can you see me now?
We can see you now. Yeah.
I'm wondering whether I should turn down one light just to see.
No, we can see you, Diana.
Is this better or is the previous one better?
Either would do.
Okay. All right. Okay. Good morning, everyone. Thanks for having me once again, and it's a pleasure to be on this CAHN Health Hour this morning. I hope everyone is fine. I'm doing good. Thank you. Right. So this morning we're going to be talking about flu because we're currently in the flu season in the United Kingdom. We all know that usually as we sort of head into autumn, flu is one of the big things that we need to deal with as a National Health Service and as a population group. There are several at-risk groups regarding flu, and there are several people who would be eligible for flu vaccinations. I'm sure you've got lots of questions about the flu jab and everything surrounding it. So I will attempt to be of help today and to the best of my ability try and sort of answer your questions or your queries. So just a little bit of a background. I'm trying to share a screen. I prepared a few slides, so just give me a few minutes to try and find my slides. Right, 2 seconds, please, while I try and get the slides. Sorry, it's always the way. Technology. We prepped everything up and got it all ready, and then here we are. It's trying to let us down, but I think I need to go on here. Right. Okay. While that is going on, I'll just start talking because I know that we're dealing with time, and as usual, technology trying to let us down. Can you hear me anyway, please? Okay. Right. So hopefully when the slides come up, I'll show them, but at the moment I'll just carry on speaking. So essentially, flu, one would wonder and say, you know, what is the flu? And we know that the flu is called influenza, or that is the actual name for the condition, influenza. And then it's a respiratory tract infection which can be caused by viruses. There are different viruses, different strains of viruses that cause the flu. Commonly in the United Kingdom, we have the flu, influenza A and influenza B being the most common causes in the United Kingdom. So that's what we tend to see a lot of. Generally, it's a self-limiting condition. So if you are a healthy person and you get the flu, then generally your body has the defenses to be able to fight the flu, and you'd usually be fine. Of course, you'd be a bit ill, but after a few days, your body can fight the disease. If you're someone who has underlying health conditions or someone who's unwell or poorly, or you've got other risk factors, then something which is the flu, which normally your body will be able to fight, can then overwhelm you and give very serious illnesses. Sometimes it can lead to severe complications, and then it can actually sometimes cause death in certain cases. So let's see what this is. Can you see the slides now, please?
Yes, we can.
Oh, thank God for that. Okay, so we're on that screen. Sorry, I've got someone in the background trying to help. I'm not quite sure whether this is actually helping or not. I'm probably better off just speaking with other slides. But anyway, there we go. So back on track, we were saying what the flu was. We were saying that it's caused by a virus. It's influenza. That's the name of the disease or the condition. It's a respiratory tract infection. And commonly, we've got influenza A and B in the UK. If you're well, you're healthy, then when you get the flu, hopefully you should be fine. But if you have underlying conditions, then when you get the flu, it can end up in big trouble sometimes. So what are some of the common symptoms of a flu? They're very common things that people can get, but then when you have a flu, for those of you who've had flu before, you will know that it makes you quite unwell. So you really come down with a high temperature, usually very suddenly, a high temperature of over 38 degrees. You've got aching muscles all over, chills, cold sweats, a raging headache. Some people have a sore throat or dry cough with the symptoms, and loss of appetite, tummy pain, nausea. But I think one thing that anyone who's ever had the flu will never forget is you get this high temperature, you're really weak, very achy all over, and it feels very dreadful. If it was in Africa or in the Caribbean or in those days when people used to get malaria, you almost feel as if you've got malaria. I don't know who has had malaria before, if there are any hands who can go up to show me if anyone has ever had malaria before. That's the kind of, so that's the kind of feeling you get. I can see you, ma'am. Thanks for that. So that's the kind of feeling you get when you have a, it can make you very unwell. But as I said, if you're healthy, then your body is able to deal with that. So those are the common flu symptoms. And usually with rest, with fluids, supportive measures, within a few days, you're fine and you're back to normal. So that is the flu. Now, what is a vaccine? Because we're talking about the flu vaccine here. So what is a vaccine? Basically, a vaccine is a medicine that has been put together from the killed form of or the weakened form of something that causes disease. So in this case, the flu caused by the influenza virus, it will be a weakened form of or the killed form of the influenza virus made into a medicine, and that is a vaccine. It's meant to generate a response in your body, what we call an immune response. It's meant to get your soldiers that fight disease all ready and activated. It's just enough to create the soldiers to be alert, the soldiers to be ready, the soldiers to be present, so that when you actually get the flu, you've got the defenses against it. The vaccine doesn't cause you to have the disease. The vaccine doesn't give you the disease. And it's quite important that we get this message home, because some people feel that when they take the jab or they take any vaccine, they're getting the disease. That's not the case, because it's a killed form or a weakened form. Yes, there are some live vaccines, but even then, the doses are measured such that it's not one that's going to give you overwhelming disease. It's just enough to generate an immune response, which then gives your body an advantage for if you do encounter that illness in the future. No vaccine is 100% effective. So there's no vaccine that we can say that if we give it to you 100%, you're never going to get this disease, or the whole population that was vaccinated will get it. But most vaccines have a very high effectiveness and efficacy, which means that they will have the ability to protect against that particular disease and in a high number of people. So for instance, with the flu, it tends to vary from year to year, but generally sits around 7 to 8% at least. Sorry, 7 to 8 out of 10 at least. So if you vaccinate 10 people, you're guaranteed that at least 7 to 8 of them will be effectively protected from having the flu. It's also important to mention that even if you did go on to get the flu, then you get a much milder form because your body is geared up already. Your body is in a state where it's able to fight this disease. So that leads us on to where some people say, oh, I'm not going to have my flu jab because I had my flu jab last year. And as soon as I had the flu jab, I came down with the flu. So possibilities are you probably were incubating the flu anyway before you had your vaccine. And so you didn't know that. So it's not the vaccine that gave you the flu. Or possibilities are, if you hadn't had your flu jab, that flu that you had, that flu that you had would have really caused you a lot of damage. It could have made you a lot more unwell. But because you've had the flu jab and you've got built up some immunity, it's giving you some level of protection so that although you might have had the flu, it wasn't as bad as you would have had if you haven't got a flu jab. Right, so, and again, people's immune systems are different. So if you give the same jab to everybody, everyone responds slightly differently. The degree to which Mummy Lane might respond might be slightly different to the degree to which I would respond, might be slightly different to the degree to which Charles might respond to the vaccine. Now, how do they come about with these vaccines? We know that the flu jab itself has been, it's been a seasonal immunization that's been recommended in the UK since about 1960s. So it's been around for a long time. The aim of it is to reduce morbidity, where morbidity means making people very unwell or very poorly, and mortality, where mortality means death. So basically to reduce people becoming so unwell to the point where it's affecting their state, their physical state, or their sort of functional state, and their mortality being literally reducing deaths. So that was the aim of the flu jab. And usually it's given to the people who are most at risk of getting it, because those are the ones you want to target first so that you reduce the overall morbidity and mortality. And every year, the WHO would look at the strains that are prevalent, or the strains that are common, that are likely to be the most sort of common that winter. And then they put together a vaccine based on all this information from worldwide monitoring. They put together a vaccine depending on those strains for that year. So the flu jab every year varies a bit because maybe the flu strains that were prevalent last year might be different from this year. So it's a really useful thing, the flu jab, because it's not just something that has been cooked up out of no evidence. It's a very evidence-based vaccination based on the prevalent strains that are put together so that we have the most chance of getting the best results possible when we do the vaccinations that particular year. So just to reiterate, the flu jab in particular, it doesn't contain live vaccines. So we're not giving you the actual influenza. It doesn't contain live vaccines. It contains inactivated vaccines. So as I said, it's the killed form of the bug, or in this case, the virus that is causing the disease. And there are some attenuated live vaccines, so the weakened form. Commonly in the nasal sprays, you tend to have the weakened form, which is attenuated live vaccine in the flu jab. It's a very safe and effective vaccine. It's been around for a while, as I said, since about the 1960s. So it's something that's been around for a while. We've already established it minimizes the risks of you getting the flu and its complications. So it doesn't 100% say you're never ever going to get a flu, but basically it says it really minimizes your risk of getting the flu. And even if you were to get the flu, you're going to get such a mild form that it would not be overwhelming your body like it would have done if you didn't get the vaccination. It's given yearly to at-risk groups. Now, at the moment, we all know that we've got a pandemic going. So even normal time when there is no pandemic, as Charles put in the flyer, we have about 10,000 deaths from flu, generally in England and Wales. So that is even without COVID. This year, we are up against a very steep hill. We've got the COVID pandemic to deal with anyway, which is a battle on its own, and a huge challenge to the National Health Service and to our lives as well, as we can all testify. And then on top of that, we're expecting we're entering into the flu season, basically. So we've got two uphills this winter or this season. And that is why it's very, very important that we all make sure that if you're eligible for your flu jab, then whatever you can do to minimize your risk of getting the flu, you do that. Because otherwise you're going to end up poorly with the flu in a situation where the NHS is already stretched, in a situation where because of COVID, there are lots of restrictions in place. So if you then get something else that overwhelms you, then it puts one in a very difficult position. Again, because of COVID and other contingencies this year, that the flu vaccine coverage has been extended to cover the over 50. So as we normally know, it's usually the over 65s who are eligible for the flu jab. And then anyone else below 65 would be someone who has a chronic condition or is in a specific risk group or is a healthcare worker or etc., other categories, which we'll talk about shortly. But this year it's been extended to cover the over 50. So you would get invitations if you're over 65s from your surgery or your health center, wherever you normally have your jab from. You get those invitations initially, and then later on in the year, round about November time, we'll be vaccinating the over 50s. It might be working slightly differently in different areas, but obviously, I mean, once you're eligible, you'll get an invitation, but you also need to make that effort to book your flu jab if you know that you're in an eligible group for the flu jab. Right, so what are the eligible groups? As I said, over 65s, every over 65 is eligible because they're elderly. They're the ones who are most at risk of being overwhelmed by this illness. They're the ones who could end up having pneumonia or meningitis or encephalitis or God forbid, even dying from the flu if it overwhelms them. So over 65s, we're definitely recommending that go and get your flu jab. As I said, the under 65s from 50 onwards have also been included in the cohort for this year. Now, those who have certain health conditions, so chronic health conditions, basically targeting all the organs. So if you've got chronic renal failure or kidney disease, those who've got hypertension, diabetes, asthma, COPD, cystic fibrosis, you name any chronic health condition, literally most of them are on that list. And you would know yourselves because year in, year out, you would have had a flu jab, or at least you would have been invited for a flu jab. And if in the past you have declined to go, then I strongly submit to you to consider accepting to go for the flu jab this year, because we're fighting two battles here, as I said, and you definitely want to keep yourself as healthy as possible. Pregnant women are also in the eligible group because obviously in pregnancy, your immune state is slightly different from when you're not pregnant. Again, you want to keep very healthy, so pregnancy poses a higher risk as well to people who would normally not have that risk, and therefore pregnant women are included in the eligible groups. Those who are in long-term residential care or care homes, they get a flu jab. Those who are main carers for people who have a disability or are relying on these carers for their help and livelihood. Because if the carer goes down, then obviously the person who is being cared for is in trouble. So as a general rule, they say those who are receiving carers allowance, because most of those who are official carers or registered carers might be receiving carers allowance. But essentially, if you're the main carer for an elderly patient or a disabled patient or a patient with multiple comorbidities, then you should be eligible for the flu jab. If you're not sure, please check with your surgery. If you're living with someone who's at risk of coronavirus, so the people who are on the shielding list this year as well, those who are living with those who are on the shielding list will also be getting the flu jab, because we're trying to minimize their risk of catching the flu jab and then passing it on to these people who are high at risk and not being shielded. So again, they're also going to get their flu jabs or be eligible for the flu jabs. And then obviously frontline health and social care workers, so nurses, carers, doctors, midwives, health and social care workers, people who are in direct contact with patients, one, to minimize their own risk, two, to also minimize the risk of transmitting to these very vulnerable people who they're looking after. Right, so We talked about what is the flu vaccine itself. We've said it's a kind of medicine, weakened form or killed form of the virus. We've said that, yes, there can be some live vaccines, but this particular flu, the flu jab itself, is an inactivated form, and the nasal spray is an attenuated live form. There's a form that comes that way in the nasal spray form. How is it administered? It's in a little, like an injection or a little needle, and it goes into the arm. So the top, generally we tend to give it on the top left because most people are right-handed, and you sometimes get a bit of an achy arm. So it normally goes into the sort of, top left, or you can have it on the top right, wherever you want, really. It's not really a big deal. If you want it on the left, you can have it there if you want it on the right. But generally we'll give it on the left because most people are right-handed. It goes into the muscle there. For the kids, we'll come to the kids very briefly, but for the kids, it's generally as a nasal spray. So unless they can't tolerate or have some reason why they can't have the nasal spray, then they would be getting the nasal spray. I've already touched on this briefly. Can I get flu after having a flu jab? So the simple question and simple answer to that, can I get a flu after having the flu jab, is no. You can't get the flu after having the flu jab because the flu jab doesn't give you the flu. However, the long answer to that is, yes, you might have been brewing a flu already before you had your flu jab. So although they say to you, and we say to you, that if you're feeling unwell, you've got a temperature, don't have your jab. Sometimes you might not even know that you're feeling unwell. You might just have these non-specific symptoms and you're not even sure that you've started sort of brewing something. So you might just go and have your flu jab not knowing that you were brewing the flu already. So if you then have your flu jab, the natural human thinking is that, oh, I had my flu jab and I got the flu. So you're going to link it to the flu jab which you had, which actually isn't the cause of your flu. So that's one aspect. The second aspect, can you still get the flu even though you've had a flu jab? Yes, you might still get the flu even though you've had a flu jab. Because as I've said, each year they're using the most prevalent or the common strains to formulate the vaccine. So there is still a possibility that there might be a strain of flu, which might not be the commonest strain, which might not be the prevalent one, which was included in the vaccine, that you can get. So you can get some flu-like symptoms if you get a strain that wasn't included in the vaccine, for instance. But because you've got that immunity built up, your response is going to be a lot better compared to someone who didn't have the jab. And then the final scenario is you can still get the flu, not from the flu jab. I need to be very clear on that. But you can still contract flu anyway, even though you've had a flu jab. Very rarely, because maybe you didn't respond properly to the jab, you didn't mount up the right level of immunity, or you got the flu anyway. But as I've said, you will have a much better response and your body will be able to fight better because it's got its army ready already compared to someone who didn't have the jab to prepare them. So those are the scenarios where you might find, and they're very common because a lot of people who decline the flu jab decline it on the basis of, oh, 3 years ago I had the flu jab, and doctor, I can swear to you that as soon as I had the flu jab, the next day I came down with the flu. Or I know someone who had the flu jab and they came down with the flu. Or I had the flu jab and it gave me a flu. And that is what usually puts people off having their flu jab, at least from my experience. So those are the scenarios where you might find that, yes, someone did have symptoms, but actually it's not because the flu jab gave it to them. It's because of the reasons that we have talked about. So that obviously leads us on to that other point, which I've listed on there. And also remember the jab, the vaccine itself, can take about 10 to 14 days to work fully, to kick a full immunity in your system, immune response, in your system. So if you have that flu jab today, excuse me, and it hasn't produced a full response yet, and you had already been exposed to the flu and you're on your way to getting the flu, then unfortunately, I'm sorry, you will get the flu. So it's not the jab giving it to you. But as I've said, the good thing is that because your body has been kicked into some response mode, some preparedness mode, some readiness mode, you will be a step ahead of the game. Right. So what are the common side effects of the vaccine? it's important to state that most people do not get side effects. A lot of people are fine. They have the flu jab, they're absolutely fine. No dramas, had a needle stuck into the upper arm and off they go. They're absolutely fine, no issues. But some people will have maybe a slight raised temperature, might feel a bit groggy, a bit of a malaise, a bit tired, slightly under the weather. Nothing to overwhelm you, but just something that just makes you feel a little bit under the weather. And again, that is another thing that might put people off, and they say, oh, I have flu jab and I felt unwell and therefore I'm having it again. These are common side effects of the jab. It's expected because it's generating an immune response in your body. So in some ways, it's even something to show that actually your body is responding to this medicine which has been given, which has started to generate an immune response. And then obviously from having the needle into your arm, some people can get a sore and achy arm. That can be quite a common thing as well, but it usually gets better. So if you do have a temperature, you can take some paracetamol, usually within about a day or two, you should be fine. It's very, very rare for people to have a severe allergic reaction or people to have anaphylaxis. It's extremely rare, but clearly if someone does have an anaphylaxis, that's a very unfortunate situation, but certainly that will go down into their medical records, and in future then the absolute necessary precautions will be applied to ensure that this doesn't happen again. So the flu jab contains egg components in it. It contains albumin, ovalbumin in it. And so if you've got an allergy to egg, if you've got an egg allergy, then please, you must let the clinician, the pharmacist, whoever is vaccinating you know, so that you avoid that flu jab. There are some no egg vaccines or low egg vaccines, which can be given to people who have egg allergies. But the simple message is, if you've got an egg allergy, you generally may not be eligible for the common flu jabs that we have around. And so you must let someone know so that they give you the alternatives. There are alternatives available. People who've had severe reactions in the past, they might then vaccinate you in a controlled environment, say in a hospital environment, where if you did have a reaction, you're in the right place with the right resources to deal with the outcome of that. So there's no excuse not to have your flu jab. There's no excuse to put yourself at risk, because there are factors that can mitigate all the sort of issues and the logistical issues that we have concerning or surrounding the flu jab. Right, so very briefly, the flu jab in children. Again, flu jab in children is free for the eligible groups. The eligible groups are 2 to 3 year olds. The dates are there. I'll put it on there because essentially anyone who was born between 1st of September 2016 and 31st August 2018, they will be eligible. They will be in that 2 or 3 year old group. And then you go to primary school children. All primary school children will be eligible. So you'll probably be getting letters from your teachers, from the schools, from the local authorities, the health authorities telling you about that. And then the year 7s as well are going to be eligible as well. Apart from these specific groups, any children who are, regardless of their age, obviously from 2 onwards, with long-term health conditions, so if they've got asthma or cystic fibrosis or something along those lines, and diabetes, then they would also be eligible for the flu jab regardless of their age, as long as they're above 2. The nasal, so theirs comes as a nasal spray. It's not an injection like the adults have. It's just a nasal spray into the nose. And that is from the 2 year olds and above. It's not licensed in the under 2, so between 6 months and 2 year olds. They can't have the nasal spray because it's not licensed in that group. And therefore, if they need a flu jab, then they would be having the injection, unfortunately or fortunately, depending on how you feel about injections. Right. So if your child is unwell on the day of the flu jab, the runny nose or blocked nose, it's best for you to wait till they get better, because it's a nasal spray. If they've got a runny nose or a blocked nose, they might not absorb it properly. So it's important that you wait till they get better. Obviously, if you've got a high temperature, you should wait till you get better, because You might be brewing something already, you might be feeling unwell already, so you don't want to then take something which is also going to further generate an immune response and could make you more unwell. At the moment, as I've said, we are battling with both COVID and the flu this winter, and so we all need to take extra precautions. When we go back to that slide about the symptoms of the flu, you can see cough in there, you can see temperature in there. And we also know that the symptoms of COVID at the moment, cough is one of them, temperature is one of them. So obviously, if you have a cough or you have a temperature, you're COVID until proven otherwise. So these same symptoms can also present in the flu or in a flu episode. So we can see why it's important to try and minimize as much as possible the ambiguity, but also improve our ability to fight against these diseases. So the flu jab is not going to protect you against COVID. They're two separate illnesses. So certainly the flu jab doesn't protect against COVID, and the flu jab is not the COVID vaccine. But the flu jab is going to deal with the flu side of things and minimize your risk of getting flu and minimize your complications from flu if you did get it. But if you can prevent yourself from getting flu in the first place so that you don't end up with a cough or a high temperature, and then you then need to self-isolate, and you then need to get a test, then you then all the things and inconveniences that comes with having suspected COVID symptoms. If we can minimize that, it would help. So self-care measures, as we've all been doing over the last few months, washing our hands, you cough, you bin it, you sneeze, you wash your hands, you bin your tissue, making sure that we're keeping ourselves safe, making sure that we are having the social distancing measures, obviously for COVID, but again, it stops us coughing and sneezing on each other, so that's useful. Face coverings where we need to apply the use of that. They're all important. Looking after ourselves, keeping healthy, drinking, keeping hydrated, exercising regularly, eating healthily to keep our natural immune system up. And then the flu jab is just an artificial thing which has helped to boost things by generating a natural immune response to fight against the flu. So please go for your flu jab if you're eligible. Find out from your GP if you're not sure whether you're eligible or not. The coverage is wider this year. The eligible groups has been spread even wider. So previously where you might not have been eligible for a jab, you will be this year. So please check, because as I've said, there are a lot more criteria that have been added, like, shielding patients will be in there, household people living with shielding patients will be in there, carers are in there, over 50s are in there. So you may well be that last year you didn't have a flu jab or you weren't eligible, but this year you are. So please get your flu jab. Be a flu jab superhero. I just pulled this off the internet because I thought it looked interesting and it looks funny. But it sends one the message that we need to protect ourselves, we need to protect our families, and we need to protect the nation, and we need to protect the NHS. Because if we all do this together, then we will not overwhelm the system, we will not put ourselves and other people at risk, and we'll do our little that we can to make a difference. So these are some of the websites, Charles, if you want to put them on your CAHN page for people to go and have a read about. Most of the information will probably be from these websites. Very simple to understand, easy to understand, and people can read them if they want to just digest it a bit more further. Right, thank you. Any questions, please?
Great, thanks for that, Dan. You can, if you stop sharing your screen, then we will have you.
I think I've clicked stop. I don't know whether you can see me now.
No, not yet.
Not yet, right. So I've, what do I need to do? I've clicked on the stop share.
Okay, I'm sure you come up soon. I'll crack on with the questions. So there's a question here. Overall, Black people are fearful about having vaccinations for a number of reasons. And, it's all about the trust based on past experiences. And therefore, they don't tend to come forward to participate in research trials. how do you think we can work to address some of the concerns that we have?
So what are the actual concerns that we have? Because that's what's going to help me answer the question. So yes, we are fearful. Yes, we're afraid. But what is the reason? What is our fear? So that collectively and as a group, we can address that.
Well, I think one of the notions that I've heard about is, you know, the system using us as guinea pigs.
Right. And when we say that, what do we mean? Are we thinking that they're giving us something to kill us, or what exactly? I want us to be direct and open so I can also openly address what the concerns are. Because if I'm assuming something else, then I might not give you the right answer.
Okay, I'm sure the one who's asked the question will come back with further information. So I'll move on to the next one.
Okay, but just briefly on that, I mean, if you can imagine that, for instance, in our surgery, we've got flu jabs, we've got a fridge for the over 65s, fridge for the under 65s. We don't label them by names or color or race or anything. And essentially, if you remember in the old days when people used to just turn up with their sleeves rolled up and you get jabbed all in a queue. I mean, obviously now with the social distancing measures, we've got to have measures in place for people to turn up at a specific time to make sure that we're keeping to the COVID protocols. But, you know, if you've got about 50 or 60 odd people turning up, how can the system manipulate a specific flu jab to give Charles, you know, some poison when he turns up, when actually we've got a batch of exactly the same thing that we're giving to everybody? So I would like that person to let me know what the actual concern is, but I can certainly reassure you, working directly on the front line, that there isn't any mechanism by which, you know, you would know that Mrs. Johnson is the one turning up. She's number 5 in the queue. So when you get to number 5 in the queue, swap it and give her something else. We've basically got a batch of 100 jabs that we're giving this morning, and we're basically jabbing 100 people who turn up. So I'm not quite sure how that really works. And I can assure you that that isn't the case, but I'll wait for whoever it is to let me know what the actual issue is so that we can allay our fears. It's important that we get the right information so that we can allay our fears. I know that we all have fears based on previous experiences. It's important that we get the right information so that we can allay our fears, and we then don't put a barrier between ourselves and getting the things that would help us. Thank you.
Great.
Charles, can you see me now?
Yeah, I can see you.
Okay, Sandy said.
So the other question is that, are there any groups of people who should not take the flu vaccine? And if so, why?
Okay, so it's an interesting question. Are there any groups of people who should not? I don't think there are any groups of people who should not, but because it's a free thing and it's a limited resource, and you're targeting at-risk groups, we are vaccinating the people who are at risk. So you remember at the beginning of my talk, I said that it's a self-limiting condition. It's a bit like you have a cold and your body is normally able to shift it. I'm sure if there was a vaccine for cold, even though we all get colds and we get over it, everyone would want it because it's not pleasant when you get a cold. So although your body can deal with it, you would rather still not have a cold. So if everyone in the world could get a flu vaccine so that we don't have anybody getting flu, that would be great. But of course, that's not the case. We can't have a flu jab for every single person. So we look at who are the people who are more at risk. And those are the groups that we've mentioned. And the healthy people, if you haven't got any conditions, you're generally healthy, then naturally your body can shift it. So really, apart from the inconvenience of you going through that sickness for a few days, which your body will shift anyway, you'll be fine. You know, all things be equal, you'll be fine. So there isn't any group that shouldn't have it because they're not supposed to. But in terms of on the flu vaccination program, who are the people who will not be having it? Healthy people without any chronic health conditions will not be eligible. So they'll not be given the flu jab. It doesn't mean that you can't go and pay for it if you feel very strongly about having it. You can do that. But those are the groups who will not be eligible. So I'd rather use the word eligible on the program rather than should not have it. as for having it, I'm sure if everybody could have it, that would be great. But then in the vaccination program, it's targeting the at-risk groups. And also, if you're healthy, you don't really need it because your body has that immune system to be able to deal with it. So that's why. I hope that answers that question.
Okay, thank you. I mean, yeah, you did touch on children. You know, why are school children targeted, or why are they included in the at-risk group?
Yeah, so there's children are included in the at-risk group because obviously we know that children are now growing up. If you think of your age and probably the number of flu seasons that you have experienced in ever since you were in England, you know, you've been exposed to the flu several years. Your body has developed immunity to it. These kids are now growing up. They haven't got their own immunity to a lot of things. Same sort of principle with childhood vaccination. They're coming into the world. They haven't quite built their immunity yet. They might not have been exposed enough to develop the right level of immunity. And so we put them in the at-risk group as well. Obviously, studies have shown that they would benefit as well. So if you look at the benefits of them having it to minimize their risks and the risk of the complications that they would get, then obviously vaccinating them is a better option. So that is why. By the time they've sort of grown and they're a lot older, then they're probably in the category of where we might be, where you've had it so many times, your body has dealt with it, you've built a good level of immunity, and unless you've got a chronic condition, your body would generally be able to fight it like it fights most other viruses. Thank you.
Okay, thanks. I think Charles has a question. So, Charles, do you want to ask, or do you want me to ask it? So if you are not eligible for flu vaccine, is there a herbal remedy that you would suggest?
Right, that's a very tricky question, Charles. I personally wouldn't be able to suggest you any herbal remedies because that's not my speciality. So I don't have any sort of concrete, validated knowledge in herbal medicine. So I wouldn't be able to tell you what to take, which would be at par as having the flu jab. But what I can say to you is that anything that boosts your general immunity, as we mentioned, you eating healthily, drinking, often exercising regularly, keeping a good weight, having lots of fruit and veg, all those things boost your immunity anyway. So it gives you a good immunity to fight not just the flu, but any virus or any other conditions that you will get. So as to specific herbs, I wouldn't be able to name those, I'm sorry. But I can tell you that whatever will boost your immunity generally will be in your favor. And that is important that we realize that overall healthy lifestyle increases our immunity towards diseases in general. Thank you.
Right, I think Papa has a question. So Papa, could you unmute yourself and ask your question?
Hi, hello, good morning there, Dr. Asante. Very interesting and very good. Thanks for helping the community to understand many of these things. My question to you is that what is the difference between children who are born in this country and children who are born in the third world that don't receive any jab, but yet they are able to withstand much more viruses than the children here, because God has created the body in such a way that it doesn't require all these things to make the body to be wanting any form of intervention with chemicals. Because I believe that as a child grows up, I mean, I'm one and you are one. I remember I used to eat things off the floor and never had any form of infection or anything whatsoever. Yet, when we go to third world country from here, our children seems to become a bit very less resistant. So for me, I believe that those jabs doesn't really help, rather it causes much more problem to the children. because children are resilient, and as they grow, the immune system become robust with the environment that they play. And that environment is such that it has all sorts of things that you bombard into their body, and they are able to absorb it and create antibodies. So by giving them these injections, because I, for one, all my children in this country are never allowed a jab. And they're still alive today, kicking, healthy and robust. So it begs the question, why this intervention?
Thank you. So that's a very useful question, very relevant question, because I'm sure it's something that goes to the minds of a lot of people. So back to what you were saying at the beginning, you said children who are born in third world countries or other places have better immunity. They eat things off the floor, they're licking stuff, they're touching things, and they're absolutely fine. Now, just tackling that little bit first before we transpose them into the first world or Western country or whatever you'd like to call it. When they're doing those things, you will bear testimony, if you've had that experience, that is they're building their own immunity in a way. But can you remember the number of people who used to have diarrhea, vomiting, who used to have a temperature, who used to have all sorts of things when we were back home? I don't know where you're originally from, but I can certainly tell you that when I was in Ghana working as a doctor, or even growing up, there were lots of these illnesses, and people used to die from things that they shouldn't be dying from. There was a lot of mortality, which if you look back now, you think that actually, if it was today's world, this person would not have died. So you are absolutely right. If you're eating things off the floor and you're licking germs, your body will be able to develop some immunity. But in some cases, it will kill you. And we know that it does kill people. So why the need for these interventions? The need for these interventions is because as time moves on and technology moves on, people are realizing that, yes, we can leave the body to learn the trade, do its own thing, and find its way of dealing with these things. Or we can learn from the past, from what's happened previously, and we can develop things that would help. So we transpose these kids into England, for instance, and now we are giving them vaccinations and this and that, and your feeling is that probably we are disadvantaging them because we're not allowing them to develop their own immunity. It's because clearly in the westernized world, they would do things differently, and they would want to prevent as many deaths as they can, as many mortalities as they can, as many complications as they can. I'm sure if Africa, we had the means to do that ourselves, we would also want to prevent as much as we can. Look at malaria, for instance. We haven't to date found a vaccine for malaria. People do get malaria and people live, people survive. But people get malaria and some people become very unwell and some people die. So it's just all about the human race evolving. I completely agree with you. God has given us that strength, that ability to be able to fight things, to be able to deal with things. But if we are putting it in the context of social care and health care for all, then we're looking at an effective and an equitable way where we can help to minimize the impact of people getting ill in the first place. Because if we can prevent people from getting ill, then that is better. So I know you might feel strongly and feel that you don't want your kids to have vaccinations, which is your personal preference. It still doesn't negate the fact that if they did have vaccinations, it will help their bodies to generate an immune response. Because it's a bit like saying that you wouldn't let your children eat from the floor, pick up food from the floor if they were in Africa. In a way, that was their way of having their own vaccination. I'm not saying people should be picking stuff off the floor and eating. Please don't misunderstand me. But what I'm saying is that whenever our body gets exposed to something, the body generates an immune response. We're either able to fight that disease and win, or we might not be able to win, or we might have a situation where we get overwhelmed. So the whole idea of these vaccinations is to try and help generate an immune response to put the person one step ahead. so that if they did encounter that situation, it would be better off. It's also because in the past, if you think of how flu has killed people, how things like polio kill people, things like measles kill people, they realized that, yes, a lot of people died unnecessarily. And with medical science advancing and realizing that if we can do something to minimize this, then let's do it. That is why this has all come about. But equally, if we did nothing, some people will be able to fight these diseases, but a lot more people will die than those who will be able to fight it. So that is the rationale behind it. And I hope that it convinces you to allow your kids or your grandchildren to have vaccinations. We are here talking on the computer. 50, 60, 80 odd years ago, we couldn't see each other from different parts of the world, because then we didn't have that. Technology has advanced and now we are here. Are we going to say that because 70 or 80 years ago, people didn't speak on the computer, so today, even though there's a computer, we wouldn't, use it to our advantage? No, we're moving with the times. And as long as we're not doing anything that is against our Christian ethics, it's absolutely fine. Jesus said to the man, he said, I've healed you, but he said, go to the river Jordan and bathe 7 times in there. He could have just said to him, you're healed, and off you go. But he said to him, go and see the prophet and bath in the river 7 times. So even when we believe in God, he's still given us the wisdom to be able to do things. He's the one who equips us to do what we do. He gives us the wisdom to do what we do. So I'm hoping that this sort of answers or sort of, meets you some way in explaining why. Thank you.
Thanks, Dan. Professor Donage, do you want to expand on your comment? You can unmute yourself.
Is that me, Papa? Is that to me, Charles?
No, we have someone who's put a comment in the chat box. So
thank you, Charles. Really, it's very much reinforcing what the doctor was just saying, that we need to remember that some of the illnesses that have been eradicated in this country are still killers. And certainly last year, so as you know, I'm an academic, I work in a university, and last year, not just ours, but at many universities across the country, we saw an upsurge in the number of young people with mumps, because they hadn't been vaccinated, and some of them were very ill. Because as you know, some of these illnesses, which are relatively trivial in children, but can still be killers, are very serious when they happen in adults. So I'm sure Dr. Asante can explain, things like with mumps and young men, which can cause them to lose their ability to affect their fertility, and all kinds of other really serious complications, as well as ultimately death. So I just think it's very important that we get good information as we are doing here. So thank you to CAHN for putting this on, and for the doctor to give us our time. And then with that, we can use wisdom. I too am a Christian. I believe in healing. I believe that the Lord has given us everything we need for life and godliness, but that includes doctors. Luke himself was a doctor. So it's not one or the other, it's both. Thank you.
Absolutely.
And thanks, Professor Donage. Right, so there is another question for you, Dan. There are stories being circulated that if people go forward for flu jab, then actually they might be given vaccine, COVID-19 vaccine trials. I know, well, I'm not aware of any, vaccine for COVID, and could you, expand on that?
Okay, all right. I'm not sure where these stories are circulating or what the source of them is, but I'll just address the subject of that matter. So if you, so basically the assertion is that theoretically, if people go forward for a flu jab, they're going to be given a COVID-19 vaccine. Let's be realistic here. When we're doing vaccine trials, in the first place, we haven't got a COVID vaccine yet. So there's no way that you're going to turn up for a flu jab and someone gives you a COVID vaccine, because the vaccine doesn't exist yet. Now, the trials that they're doing, when they're doing trials, they're doing it in controlled environments. They're doing it with people who they're monitoring closely. So at the moment, what they're doing is they're introducing the vaccine into people. They're monitoring the antibody response, the effectiveness of these vaccines, how efficacious these vaccines are, to be able to then, based on that number of people that they've looked at, then draw the data to say whether that particular vaccine is effective or not. So if, let's say, I, Diana Asante, turn up for a flu jab, I've not been told that this is a COVID-19 trial vaccine, and I'm turning up for a flu jab, and you give me a COVID-19 vaccine, and I go off on my merry way, and you never hear from me again, because of course I didn't know you've given me a COVID-19, and I'm just carrying on with my business. How do you measure whether your COVID-19 has worked? How do you know? What do you actually achieve from giving someone something which they don't even know that they've got, and you would have no way under the sun of getting them back to get the feedback? How do you phone someone and say, Mr. Charles O'Doy, actually you turned up for a flu jab, but it was a COVID-19 vaccine, so we want to know, you know, whether it's worked or not. You know, how do you even start such a conversation? So I'm really sorry, but sometimes we need to be very critical of all these things that we hear and just analyze it a little bit more. So that's how trials work. So I can't see how people turn up for a flu jab and be given a COVID-19 vaccine trial. I can't see that. But for anyone who's feeling that way or wondering about that or worried about that, on the basis of clinical knowledge and on the basis of how these trials work, I can't see it being an advantage to either party. It wouldn't be an advantage to the patient, and it wouldn't be an advantage to the people conducting the trials, because they wouldn't be able to get their information that they need. So I'm not really convinced that this is something that would be happening. And I hope that that puts whoever's mind at rest. Besides, when we are sourcing flu jabs, the people who are doing the flu jabs, they're people like me and you who work in the hospital. So I'll use my surgery as an example. We've sourced our flu jabs. They're ready. We've started jabbing. We've been doing our flu jabs for the last few weeks. So it's practically impossible that there could be some COVID, you know, trial vaccine sneaked in there without us knowing. And who do we then know? You know, I'm sorry, I'm not sounding, but can you see my point? Can you see where I'm coming from? You've ordered a batch of flu jabs, let's say 1,000 flu jabs to give your patients. Someone has sneakily put in some COVID-19 trial jabs in there, which you're not even aware of. So Mrs. Brown turns up and you give it to her. She doesn't know, you don't know. Unless, of course, there's some conspiracy, which wouldn't be happening, because that would involve us, and as doctors, we wouldn't be doing things like that. So if they put it in there without telling us, how do they measure who had it and what's the effect? So the simple, really, explanation to that is I don't think it's something that's happening. So let's just get that out of our heads, and let's just move on positively. Thank you.
Thanks for that, Dan. I think we would arrange a session and get, you know, one of the doctors involved in the vaccine trial for COVID to come on this session, you know, and take some questions. Yeah, Dan, I know, you know, there are some people within the Christian tradition, but predominantly the Muslim community who obviously don't take in POC. So we know there's an issue with flu vaccine and porcine. You know, there is an alternative, but could you expand a bit on, you know, what you're seeing on the front line, and, you know, when will that alternative be available?
Right, on the front line, I'm seeing patients who are eligible who are coming forward. I'm seeing patients who are eligible who are not coming forward, and we're reminding them and saying, please, you should come forward. I haven't specifically encountered any issues with a Muslim patient not coming forward for their flu jab or declining it. I know that if people have had concerns with their flu jab in the past, they've raised those concerns. And as I've said, there are alternatives. There is an egg component to the flu jab. But if you do have a problem with that, then as I've said, you please need to let your health provider know so that they can get the alternatives. If people have concerns about porcine components, again, it's the same way. Let whoever is giving you the jab before, of course, before, you don't turn up and then say, this is it. before you put your name down for it or you book your appointment. Let them know what the concerns are, so that if we've got alternatives, we can source them. As much as possible, we do try and source alternatives where possible. And obviously, if it's not possible, then we'd need to just find another way around it. But that will be a minority of patients where there'll be those concerns to the point where they wouldn't want to have the jab. Most people would be able to have the flu jab. Most people wouldn't have any issues with getting the flu jab.
Thanks. Any last question for Dan? No. If not, your closing words.
Right. No more questions, right? Okay. Right. So closing words. I just want to say that flu is a fairly common illness, especially in the winter. Most people will get flu, but a very mild form of it. People who are at risk, who have chronic conditions, underlying health conditions, are in certain age groups, are in the at-risk groups that we've talked about, are at a higher risk of getting the flu and getting complications from the flu, up and including death. And that is why we want to minimize the mortality, minimize the morbidity, minimize the complications from getting flu. So although the body might be able to deal with it, the body may not be able to deal with it, and you might end up in a very severe situation. And so that's the back on which we're encouraging everyone who's eligible for the flu jab or is in that at-risk group that we've talked about to please go and get your flu jab. We've also got a pandemic. We find ourselves in the middle of a pandemic. We're struggling at the moment with that. The NHS could be overwhelmed if things get worse than they are at the moment. And so having another flu issue to deal with would be very overwhelming for everybody, not just the NHS, but if the NHS suffers, we suffer. So if you have a flu illness, which could have been mild or could have been not of any consequence, and because you may not have had your jab or because you are in an at-risk group, you end up developing a severe pneumonia and you need to be in hospital in the midst of a pandemic, you can imagine how much of a serious situation that would be. And so please, I would encourage each and every one of us to get our flu jabs, to get booked, to get jabbed, encourage the children to get their jabs. By boosting their immunity, we are not destroying their immunity. Because the whole thing about our body is that we get exposed to lots of things every day, and we get our immunity built up from the things that we get exposed to. So by boosting our immunity, we are not destroying our kids' immunity. We are rather giving them an edge over these diseases that have been killers in the past. They have wiped away millions of people in the past. And so if by God's grace is given wisdom to people to develop things that can be used to help mankind, be used to help our communities, let's all engage. Let's all let the coverage go up and take as much as we need to in terms of coverage, and protect ourselves, protect our communities, protect our nations. And thank you so much for having me. If there are any further questions, you can send them to me, Charles, and I can send you some answers.
Yeah, well,
God bless you all.
Yeah, sorry, Dan. One more before you go. We're seeing a potential second wave, COVID-19 cases. A lot more people contracting it, and sadly, a lot more people beginning to die. What is your advice? What you're seeing? How can we protect our children and our children interacting with their grandmothers and stuff? What do you have to say about that?
Yeah, yes. It's sad that things are heading in the wrong direction again. We obviously had a slightly better time after the lockdown during the summer, but obviously things are heading back in the opposite direction now. The advice remains the same. It's not changed. That the virus hasn't changed, and the advice is the same. Let us continue making sure we are washing our hands, we're protecting ourselves, we're gelling our hands where we need to, we are using our mask, we're adhering to the distancing measures. I know that some of the measures can be restrictive, and I know there's so much circulating on social media about people feeling that it's a bit too much. But let us also think about the flip side, that if nothing is done and we're in a very bad situation where we potentially are all very ill or end up in ICU, or, you know, people are dying at very high rates. That would not be worth it either. Our kids are in school. The teachers are doing a really good job as much as they can to keep them away and apart. The bubble system seems to be working, but the risk is still there. So let us educate our children. Let us tell them what they need to do. And ourselves as well as households, let us stick to whatever local measures are in place. At the moment, it's all different depending on where you live. Some people are under lockdown, some people are not. The rule of 6 is running across the board anyway. Some people are sort of high risk, medium risk areas. But wherever you are, whatever the local measures are, and whatever we can do as a community to protect ourselves, let us do that, because we do know that we are at a higher risk of having adverse outcomes if we do contract COVID. And so please, pretty please, my simple message is what we've been doing the whole time, let's continue doing it. Let us not relent, let us not faint. And as the Bible says, if we don't faint, in due course, we will receive our reward. So I am sure that if we keep pushing by God's grace and through the wisdom that he gives us to do his work, we will be able to get to a point where we can overcome this. The reality is that COVID is probably not going anywhere for a while. So we need to learn to live with it. We need to learn to adapt the way we do things. And we need to learn to adhere to whatever will keep us going until we get to that point where, like we've talked about the flu vaccine today, we can hopefully have an effective COVID vaccine and things can be a bit better. But until then, and even beyond then, we still need to keep on with the measures. So that's my simple message to everyone. Thank you.
Thanks a lot for that, Diana. We've posted a couple of flyers in the chat box. There's a Windrush Legacy event happening this afternoon between 1 and 3 o'clock. It's all via Zoom. And then between 5 and 7, if you belong to a church or you know someone who goes to a church, CAHN is having an engagement session with church leaders, you know, so pastors and church elders, you know, just to talk about the services we run, but also to listen to them and explore how we can better support their congregation members. And, you know, we've taken hold of, we have some free reusable masks that we've printed. We have some disposable masks as well. And we want to support the church leaders because we know a number of them have reopened to keep their members safe. So once again, thanks everyone. And, you know, for your participation. On Tuesday, we'll be having our session on physical activity and nutrition. So please do not miss that. And, you know, by all means, you know, next Saturday as well, we'll be back in here for, you know, another session of Health Hour. We'll be with Dr. Joseph Omofuma, you know, exploring mental health and why early, you know, access to services is important. So once again, Diana, you know, thanks. You know, Diana is my childhood, you know, classmate, known her for about 32 years. You know, we're really grateful for your time. You know, on YouTube, someone said you're really smart in your answer to, you know, children picking up food from the floor. You know, so we thank you for the time you keep giving to us, you know, engaging with the community, offering reassurance. Because I think for some of us, including CAHN, what we keep advocating for is people with lived experience, people who look like us, who have grown and have experiences like us. They need to champion some of those messaging, whether it's around COVID, whether it's around, you know, driving down health inequalities. So we're really grateful for your time and that of your colleagues. So have a wonderful weekend, and we will see everyone, you know, on, you know, I mean, about 1 o'clock, and those who are church leaders or belong to churches will see, you know, your pastors and your church elders, you know, at 5 o'clock. Diana.
Thank you very much for having me. It's always a pleasure. Thank you. God bless you all. Have a wonderful day.
Bye.
Bye.